Good afternoon, listeners and viewers, and welcome to Health Habit, your one-stop shop for all information on all viral known infections. My name is Jamesia Ingram, a public health specialist working in collaboration with the Bahamas Ministry of Health to educate all Bahamian citizens. Today's topic of interest is dengue fever, a mosquito-borne disease that continues to plague our Bahama land. My goal for today is to speak on what dengue is, how it spreads, how to recognize it, and what we can all do to prevent it. Dengue fever is a viral infection transmitted through the bite of an infected mosquito. It is important to know that this disease is not spread through physical contact. This virus has 4 different kinds, and while infection with one kind can increase your immunity towards that specific kind, it does not work for all 4 kinds. In fact, increased exposure to this virus can decrease your immunity and increase your risk of severe dengue. This disease is popular in our warm climate, which is why dengue fever is still a public health concern in the Bahamas. Dengue is spread through the bite of the Aedes mosquito, which breeds in standing water commonly found around homes. This includes uncovered containers, buckets, and water tanks. These mosquitoes are daytime breeders, which increases the risk of exposure during normal activities such as school, work, and outdoor activities. Can occur within 4 to 10 days after being bitten by an infected mosquito. These include a fever, headache, muscle and joint pain, extreme fatigue, and in some cases, a skin rash. Most cases are mild. However, some symptoms can develop into severe dengue, which include bleeding, fluid leakage, and organ damage. Severe dengue is a medical emergency. If conditions worsen or do not improve, seek medical help immediately. Dengue doesn't just affect the individual, it affects the entire healthcare system. Outbreaks can increase hospital admissions, put a strain on medical resources, and disrupt the school and workplace environments. From a public health perspective, prevention is far more easier than treating the disease after it occurs. There is no specific cure for dengue in the Bahamas. This is why prevention is the most effective form of protection. You can reduce your risk by wearing long sleeves and long pants where applicable, covering water tanks when not in use, dumping water surrounding your homes, using mosquito repellent, and installing screens on windows and doors. The Bahamas Ministry of Health continues dengue control efforts through community fogging in high-risk areas, community cleanup initiatives, mosquito control programs, and public education campaigns. To do your part as a member of the public, you can participate in community cleanup initiatives and stay up to date with public advisories. Community prevention is essential to reduce the risk of dengue fever. Dengue fever is a concern in the Bahamas because outbreaks have happened before in the past. These risks run high in children, older adults, outdoor workers, and those living in areas with poor drainage and heavy flooding. Dengue fever is preventable, but only if we act together. Protect yourself, protect your family, protect your community. Fight the bite, know the signs, and act early. Thank you for watching Health Habit. This has been Jamesia Ingram.